Welcome back to Hearing Consultants YouTube channel. I'm Dr. Cassie Iliff, and today we're going to be speaking about 5 common myths that my patients ask about when they come in for tinnitus treatment.
All right, myth number 1 that I frequently hear is that a lot of patients come in saying that they were told there's nothing that they can have done to treat their tinnitus. So there's no cure and there's no help. While there's not technically a cure, there are many things that we can do to help reduce the tinnitus. So there's cognitive behavior therapy, there's bimodal stimulation with linear, and the good old standby tinnitus retraining therapy and sound therapy.
Myth number 2. A lot of my patients that come in have perfectly normal hearing. And then they are surprised because they thought only people with hearing loss can get tinnitus. Everybody that has tinnitus has some degree of cochlear damage, but you can have 1/3 of the outer hair cells in your cochlea be damaged before hearing loss is actually measurable. So technically, while they don't have measurable hearing loss, they do have damage. And a lot of patients that have hearing loss never hear tinnitus, so it's neither here nor there. Myth number 3 is that there are lots of medicines and or foods that you need to avoid because they will cause tinnitus. While there are certainly people who can have foods or medicines that temporarily exacerbate their tinnitus, there's no definitive research that says these things will permanently impact your tinnitus. So for instance, I know that if I want to go out tonight and have a gin and tonic, I may have tinnitus later. In fact, I will have tinnitus later. But as soon as it's out of my system, I'm good to go. Myth number 4. A lot of my patients believe that if they don't do anything about their tinnitus and they just want to wait and see if it gets better on its own, is that their tinnitus will get worse. Or if they continue to get more hearing loss, their tinnitus will get worse. That's just not true. Tinnitus is a self-fulfilling prophecy. If you believe it will get worse, it probably will, because you're getting your emotional system and your autonomic nervous system all fired up. If you believe that it will get better and you start to relax, you're probably going to feel better. Myth number 5 is that there are herbal remedies that will cure my tinnitus, such as taking riboflavonoids. And some people may feel better. However, there is no clinical research that points in a direction that says that this is true for all. Just like anything, tilting your head this way or getting lots of sleep may make your tinnitus feel better. But taking these medications is typically not advised by anyone that knows anything about tinnitus seriously. So while there is technically no cure for tinnitus, there are many treatment options that we can offer you here in our clinic. One of them is linear, which is a bimodal stimulation. Another one is auto, which is cognitive behavior therapy. And then there's the old tried and true tinnitus retraining therapy. And sometimes it's as basic as correcting your hearing loss. So if you're looking for a solution and you're suffering with tinnitus, we are here for you. Give us a call.